When I've gone to walk-in clinics for sexual health care, it has not been good. Had a doctor yell at me to tell him how many sexual partners I've had. And I was like, 6? Which is not the right answer. Hi, my name is Zymbul. I'm 31. I live here in Toronto as a performer. I've been here for about a year and a half. What I love to do in the city is host events with Yohomo, which is an online events magazine, as well as perform. How it feels to walk into a healthcare clinic and see other Black people there definitely releases a lot of tension. My tongue unclenches, my jaw unclenches. It's a feeling that okay, I belong in this space, and that I can relate on a cultural level a lot of times. So that helps a lot because I don't feel like I'm necessarily performing this respectable Blackness in a sense. So it does open room to be more real. When I talk to my doctors about sex, I'm usually the one that brings it up. I've found as I got older, there was definitely more contention, and with different doctors, there could be more antagonism in terms of talking about sex and my own personal health care. As someone who's Black as well, who's going in there, if I don't talk a certain way, talk like I'm talking right now, if I don't, I have to be angry in a certain way that's very put together, it doesn't really allow me to fully express myself. Now, people may argue that, is the doctor's office really the place you want to be expressing yourself? And I'm like, hell yeah. Just because it does have a ripple effect. If I were to go see my healthcare provider and ask them about PrEP, I would ask them, how do I get on PrEP? What's the process? I'd ask them questions about what's the best way to use it in terms of intake, because I've heard of folks who front load in terms of taking a bunch of pills at once and then not doing it for a couple of days, or folks who do it every single day. I would bring up the fact that I have friends who are also on PrEP and would want to know on a scale how many people in Toronto are on PrEP and things like that. My most memorable healthcare experiences have been going to the clinic. I used to live in London, Ontario. I had this really great doctor when I was younger and was very open about sexual health care and talking about those things. But I would say as the years went on and using that clinic, I found that the experiences changed. I had another doctor who, when I had contracted HPV, was really pushing for this condom use thing, but I was like, okay, but if it's a skin contact thing and I used condoms and I still got it, wouldn't the natural step would be to be like, oh, maybe you need to get the vaccine, but it wasn't even offered. So those are things that I remember in terms of the antagonism and the kind of realization that I need to come prepared as a patient to talk to doctors, because otherwise it's going to be just a top-down conversation where the doctor will be like, I'm the authority here, and I'm like, nope, not of this body. I would say go to Maple Leaf Clinic for PrEP or any other HIV medication or STI testing. I would say go to ACT if you are looking for more counseling around HIV prevention or mental health. Hassle-Free Clinic would be another one in terms of getting tested. So I would tell them to go in that direction, and if things went awry from there, well, we'll find a place that's less hassling.